Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Bispecific antibodies are transforming cancer care. But before this novel treatment can reach all patients that could benefit, community cancer centers need the right infrastructure and training. Our guest today explains what's ahead for community oncology teams hoping to offer this treatment to the patients they serve. Dr. Jean Koff joins us from Emory University in Atlanta. Dr. Koff, we'll get right into it. How have bispecific antibodies transformed the landscape of cancer treatment?
Yeah, so this is a newer class of agents that have really impacted outcomes for patients with relapsed and refractory multiple myeloma and B-cell lymphomas. And now there are even approved agents in the spaces of lung cancer and certain types of melanoma. We think this is really just the beginning. We think that there are going to be many other bispecific agents that will be used potentially in other indications and maybe even combined with other agents, given that they have been found to be safe and very efficacious.
What benefits do bispecific antibodies offer in the community setting?
So because these are off-the-shelf products, they are not a cellular therapy, they are feasible for administration at community sites. Unlike for cellular therapies, there's no FACT accreditation required. And again, there's no apheresis or cell processing. Right now, because these agents are newer on the scene, there still remains work to be done to make sure that community sites have the right infrastructure and training to be able to safely administer these agents and monitor for the toxicities. But right now, I think that offers a really good opportunity for partnership between community oncology sites and some of the academic centers that may have a little bit more experience with administering these agents and monitoring patients and managing the side effects.
What are the challenges that community cancer centers face here?
So a lot of the challenges relate to that aspect of monitoring and managing the potential side effects of these agents. So for treatment of CRS or cytokine release syndrome, when it arises, you need to make sure that your healthcare system or the hospital where these patients will be going to be managed has tocilizumab accessible and available. And that may require that you have a multidisciplinary team who's advocating for that drug to be accessible at that site, including your pharmacists, your hospital management teams, and your cancer center leadership. You also need to make sure that the providers in the broader healthcare system, not just at the oncology center, are knowledgeable and trained about bispecific agents and these possible side effects. So that includes not just the oncology nurses and the oncologists taking care of these patients, but also in related hospitals, the nurses, the hospitalists, the emergency department providers, and even the ICU teams, that they're knowledgeable about these agents and what the side effects may be, because they are managed differently than typical side effects of other classes of oncology drugs.
Give us a peek into the future. What does that look like for bispecific antibodies?
So I think we are in early days right now. I think it's very exciting that we have a class of agents that seems to be efficacious and safe in a wide variety of indications. And I think it's going to take a little bit of time and dedicated effort with multidisciplinary teams to establish infrastructure at community sites so that they are able to take advantage of these off-the-shelf agents and be able to safely administer them in their own centers. But I think we're only at the beginning here. I think that as new bispecific agents are developed, there may be other indications in which they can be used. And so it will be a broader population of patients who may end up being eligible to receive these drugs. And I think also indications for currently available bispecific agents may also expand as they're incorporated into combination regimens, or they're incorporated into earlier lines of therapy, meaning that more patients will be more likely to receive them.
Thank you, Dr. Koff. ACCC is focused on expanding access to bispecific antibodies, especially in community oncology settings. You can visit the show notes to learn more about those initiatives and get more information on bispecific antibodies. Until next time, from all of us here at Cancer Buzz TV, thank you for watching.